The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Rattled Nurses family, welcome back. Happy Wednesday. It's 1,000,000 degrees outside in Texas. Hope y'all are staying cool, doing some swimming.
Yes, lots of swimming at my house.
Yes, you look a little tan. Yeah.
You're funny, Sarah. There is nothing tan about me.
Yes, there is. I feel like you got a little bit of sun-kissed color there.
I spent 3 days at the beach week before last, and I'm still as white as can be.
Why?
Casper the ghost.
Casper the ghost. Okay, you're less translucent today. I'll just say that. Will that work?
I'll take that as a compliment.
Well, good deal. We were at the beach for a family thing, and I got like 1 day of it. So, still better than me. But okay.
So funny.
A joke?
Well, let's do it.
You want to go first?
Speaking of being at the ocean, how does the ocean say hi?
It waves.
It does. It waves.
How does the pirate clean his house?
Oh my gosh, I don't know.
He pays the mermaids. How does he pay? Wait, how does he pay the mermaids?
I don't know.
With sand dollars.
Oh, goodness. Okay.
Wait, one more. Where does he keep his sand dollars? It's in the sand bank, Delana. The sand bank.
It's the joke that keeps giving.
Okay, credit to my nephew for that one. That's where that came from. And it was for me, I'm like, okay, does it end? It's still funny every time.
Yeah.
But it's not ending.
Which makes it even better.
I know.
And we were both on the same wavelength.
I know.
We did not plan. Wavelength. We did not plan the ocean theme.
No, we didn't. And that's funny.
Jokes.
We're good. Okay. All right, y'all. So today is episode 19. We're going to talk about basically vitamin K, erythromycin ointment, and RhoGAM. These may be touchy topics for someone, but we're not here to coerce you to do anything. We're just here to provide information and evidence-based research and knowledge, scientific stuff. Okay. So, that's all we're here to do so that you can make your educated decision and talk to your healthcare providers about what you would like to do, what's best for your specific situation. Okay. So, start over. So we're going to have, we call them eyes and thighs, which is the eyes would be the erythromycin ointment. And the thighs we consider, and it's just one shot, not two. It's just the vitamin K. We give that in the newborn's thigh after delivery. So we usually try to get those for baby within a couple of hours. All right. So now we're just going to break down kind of what they are, why they exist, and what they do. All right. So eyes, erythromycin ointment, that was actually developed to be given. It's given right after delivery. If you change your mind, if you don't want it and you decide later on, okay, maybe I do want it, that's fine. We can do it then too. But basically it's applied to the newborn's little subconjunctival eyelids right after delivery. And its purpose is to prevent infections that may occur in the eye, specifically one called GON, which is gonococcal, ophthalmia of the newborn. Okay, neonatorum. And what that is, it really comes from that Neisseria. I can't say all these words sometimes.
I know.
That gonorrhea bacterium that actually can cause really severe side effects, meaning like it can cause blindness in the newborn. That's why this was particularly invented, just because it was, and it happens so rapidly. The progression is so quick. I mean, you can't ask your newborn, like, hey, can you see today? Okay, can you see right now? No. So, we give that to help kill that bacteria and prevent that. It can cause like retinal damage, ocular pressure, like ocular detachment, and blindness. So that's pretty much why it was invented. It also kind of helps if you're like a GBS positive. It prevents bacterium that can develop. I've seen babies with some pretty nasty eye goop.
Looks like pink eye.
Yeah, it looks like pink eye, like lots of eye goop, and that's a lot of them were GBS. So also important to get your prenatal care done. I mean, I know this is a gonorrhea based kind of bacterium, but you know, things happen. So if you are tested for those diseases and those STDs and things like that during your prenatal care, then you can make a better decision. Oh, yes, we're talking about eyeballs.
Yes.
All right. So, yes, to prevent the disease and maintain health of your baby's eyeballs. That is why this was invented.
Yes. And you know me, I've always got some research.
I love Delana and her research. Do you need your glasses? By the way, did you guys notice the boob glasses holder? It's great. Nipples out.
We had no idea that the breast had that
Capability.
functionality.
Yes, that's now why it exists.
That's what it will be from now on. Yes. Okay. So in my research, talking back to, you know, how much progress we've made now that we've started using erythromycin ointment, this research goes back to the late 1800s.
Yeah.
So like 130 years ago, 3 out of every 1,000 infants were blinded. They couldn't figure out what was going on.
It's probably because mom looked at the moon during pregnancy.
Exactly.
Or something like that.
If you followed our crazy old wives'
tale
tales.
podcast, yes.
That was fun. So then they probably would have thought that back then. So this particular doctor that you mentioned earlier, Dr. Nesser, he started looking more into this. He was a German physician, and he started using silver nitrate in the eyes. I mean, ouch. Thank God we've advanced since then. But he started finding that he was having a much lower incidence of problems with the babies getting these terrible infections. So the infections went from 30 to 35 cases per year down to 1 in the very first 6 months, and then no incidents after that. So
that's wild.
I know, right? So then as the years progressed, of course, they started finding, you know, antibiotics, invention, and all the things. And so now, of course, we use the erythromycin ointment, which helps guard against all of that. But there are several different bacteria that can cause the problem. So it's not just something that you have to worry about. Like, we have a lot of people that say, you know, I only have one partner. Neither one of us have, you know, any diseases that we need to worry about. So I don't want the ointment. And of course, that's always your option. I mean, you are free to do that. And we don't judge. We just don't give it.
Yeah.
But I want you to make informed decisions.
Yes.
And so there are other bacteria, particularly we talked about the group B strep you mentioned.
GBS, yep.
There's also Staph aureus, strep,
the flu,
Haemophilus influenza, E. coli, and Klebsiella.
That's right.
That can all cause issues.
And those things you don't think about because, I mean, in a woman's biology, your GI tract and your vaginal canal are right there next to each other. So, yes, while we have, maybe you are GBS negative and you're like, okay, I'm not worried about that, which, by the way, let me tell you, just because you may be GBS negative doesn't mean baby's not going to come down the birth canal with eyes open, because sometimes they do that. They will come right out, boop, ready to see the world. So, I mean, but E. coli lives in the other area. So, I mean, yeah, those are things I didn't think about actually too.
Right. I mean, and as I was doing the research, I was like, oh my gosh, it's really important for other things too. Like, a lot of moms don't think they need it if they didn't even have a vaginal delivery. However, you know, if baby's in utero and your water broke before you went back for a C-section, because those bacteria can ascend up,
travel upward
the canal and into the uterus where your baby is. So
they can travel.
I mean, the chances are probably more slim, but they're still there.
Yes.
So it's just a good way to guard against running into those problems. And as well as...
Yeah, while those may not necessarily cause like some sort of immediate blindness, it's still prevention of your baby having a severe ophthalmic infection.
Yeah, and even in reading the statement from the Academy of Pediatrics, it talks about even the potential for healthcare workers or any visitors that come to see the baby or handle the baby. Everyone that handles your baby, that risk of eye infection goes up.
Yeah.
Because many of these bacteria can just be living on our skin. So,
weirdly enough, it's part of our flora. And yeah.
So it is always a risk there. It can result in eye damage, like we said, blindness, but it can even progress to systemic infections and possibly
sepsis.
death.
Yeah, sepsis and death, yes.
Yes. So just something to be aware of.
How terrible is it that this poor German doctor's last name is basically the root of a sexually transmitted infection now?
Yes.
I wonder if he's like, this is not what I intended, but okay.
Exactly.
All right. Fine.
Yeah, I don't want an STD named after me ever.
No, thanks.
Not cool.
No. Okay, so that was the erythromycin ointment. Now any more on that one? That's some good information.
I don't think so. I think that was really the gist, the highlights on that one.
Yeah, your biggest one is that, gonococcal ophthalmia neonatorum, also a GON, but that's your one that's going to cause ocular perforation, blindness, like quickly.
Yep.
Next is the vitamin K. That's what we call thighs.
That's a big one.
Yes. It is a single shot, so even though it all sounds multiple, it's just a single shot in their little thigh. Yes, we use a tiny needle. We're not giving it a big adult-sized needle, but that's also administered quickly after delivery. And again, we try to get it, if we get your consent first, we give that to baby after delivery. If you don't give consent and you don't want your baby to have it and you change your mind, absolutely fine. Let us know. We will give it. We'll be happy to give that. Okay. This one's critical because babies do not have, or they have a very minimal storage of vitamin K in their systems. That's something most of us get from our diet. So with that being said, it can cause severe bleeding. There's the vitamin K that's there to help clot is not there in newborns to help prevent massive amounts of bleeding. So it can result in, it basically is the prevention of vitamin K deficiency in the newborn. So, and that's also VKDB, vitamin K deficiency bleeding after delivery. So oftentimes with that one, you get zero warning signs. If it's a very uncomplicated delivery, great. Fantastic. There can still be bleeding that happens just because, they're usually squeezed through a tiny vessel. And if you do have a traumatic delivery, or they use forceps, or you have to have a vacuum extraction, say baby's not coming down, they have to use forceps and vacuum, God forbid, that can cause a lot of damage and will promote that bleeding. So this actually is supposed to help that baby be able to clot so it doesn't have significant damage from extra bleeding. So,
right. And as she said, the baby's not born with, any stores of vitamin K. And the vitamin K is actually created in the gut, and there's no flora in the gut when they're born. So there's nothing there. Now, when babies are about 8 days old, when they start making vitamin K.
Basically from mom's milk or whatever formula or whatever, yes.
And that doesn't even peak. They don't get to where they need to be on their vitamin K without the vitamin K injection until they're about 6 months old.
Yes. So, okay, yes, we give the shot. A lot of hospitals don't offer the drops. Why? And that's what a lot of people are going to. A lot of it is because they don't want their baby to experience a shot. However, drops are there. Sure, I guess something is better than nothing. But I will tell you, the drops usually take several doses. And honestly, it's a very slow progression of accumulation of the correct therapeutic level of vitamin K in their little bodies.
Because again, there's no gut flora.
There's no gut flora
to absorb it.
Yes,
and
it's not dissipated properly. It's not stored properly. So it takes several doses, and actually over the course of like 3 to 5 days, maybe up to a week, will you get a good therapeutic dose. Also, something that can differentiate that factor is, milk on the belly, amniotic fluid on the belly. They spit up. They might spit out the medication. It might not correctly digest, things like that. So yes, I mean, something is better than nothing, but generally if we have an acute bleeding situation in a newborn, the drops are not going to help that.
Exactly.
Not even, they just won't have that therapeutic level. They won't have that vitamin K level. So the intramuscular injection into the thigh, straight into the system, a therapeutic level. That is the reason it exists, because babies can quickly hemorrhage, causing like your seizures and death. So yes, there is an option for the drops, maybe offered, but keep in mind, it takes a while for it to get to therapeutic levels. So if you're going to opt for that, please do your research, talk to your OB about that.
Yes.
Yeah.
And a lot of times with the bleeding, especially babies, they tend to bleed in a few different places, but if it's a brain bleed,
Yeah.
when you see symptoms, oftentimes it's
too late. It's so insidious.
I mean, I did have a baby within the last year that had a brain bleed, and it wasn't caught until the baby was symptomatic. And we were having to support the baby's breathing until we could get it to where it needed to be.
I remember that baby. I know exactly what baby you're talking about.
Yeah.
Because, it was not expected. It was...
And it was not a traumatic birth.
No. I remember that because we were like, were there forceps? Was there vacuum?
I mean,
Nothing.
I'm saying it's not a super common thing, but it's always it's always a potential. And like with that birth, there was no rhyme or reason as far as we could figure out.
Yeah.
Yet it still happened. But sometimes babies bleed, in their gut.
I was going to say, if sometimes they can have a spontaneous pneumo, and their own little rib cage will puncture a lung or puncture an organ just because it's such a compact area for that baby to have to go through, even for like a cesarean delivery. It's such a compact area. So yeah, things like that can happen. Freak accidents happen. So it really is one of these situations. I think most of these are where think about your risks and your benefits. If you're risking because you don't want your baby to have a shot, it's not going to remember that shot. I don't remember getting my vitamin K. I don't remember getting any of my vaccines. I was like, you're purposely not anointed with memories at that age. But
it feels like these treatments are done to prevent, when you look back at things, you go, that was just a freak thing. That was just a freak accident. And like I said, they're very rare, but when they happen, oh my gosh, it's so bad. And so we're trying to prevent the freak accidents.
Yes, if you have, everything's uncomplicated. You never know what can happen. And I mean, these things weren't developed specifically. We want to cause harm to your newborn and jab it with a needle. No, we want to prevent any random things, trauma, freak accidents that may happen before or after delivery or during delivery. Or if you drop your baby, here's one, people get tired. Postpartum rooming in is so common now in
Yes.
most facilities. Like, we don't have a nursery to keep your baby, but dads, family members get tired, drop their
Through
babies.
the years, we've had baby drops.
Yes. I mean, ideally, we don't want that,
Right,
obviously.
right.
But, someone can accidentally drop your baby and it can come up with a brain bleed from lack of vitamin K. So it's there to prevent these types of accidents that you're not anticipating. So, again, risks versus benefits. Is the juice worth the squeeze? So,
And oftentimes, pediatricians will not do a circumcision on your baby if they didn't
Yes.
have the vitamin K.
or frenectomy, the frenotomy.
Yes.
They won't do that one either.
True.
If you've
And
got a
that's-
tongue tie, it's a tongue tie. If your baby's got a tongue tie, having trouble feeding, they won't do a frenotomy, which is just a little slice of that little skin. If you've not had vitamin K, just because of the risk of excessive bleeding. So,
And so there is the classical,
yes,
but then there's also
a late onset, yeah.
vitamin K deficiency bleeding. And according, again, to the Academy of Pediatrics, that usually occurs weeks 3 to 8. Again, the vitamin K, it doesn't get where it needs to be until they're about 6 months old.
6 months old.
So that particular bleeding, it usually does happen in the brain, sometimes in the skin and in the digestive tract. So, and then again, you wonder, with it 3 to 8 weeks, did something happen at
Yes.
home? Did the baby,
Yes.
get its head bonked on something
Yep.
or dropped, or who knows? But again, freak accidents.
Whether you
tend
do or
to
do not have vitamin
happen.
K, whether you do or do not let your baby have vitamin K, if you notice any symptoms like that, weird symptoms, lethargy, petechiae on the skin, which is those little pinpoints, that can be a sign of extraneous bleeding from somewhere, please call your pediatrician as soon as possible. Or come to if they're having seizures or, things like that, come to the ER as soon as possible. So, because you could be home, not even think about any of this.
Yep.
Yes.
And then in my research, I was seeing that, most moms that don't want to give it, they say, oh, they'll get it through my breast milk. Well,
Again,
they don't get a lot through the breast milk. From what I've read, formula actually is fortified with a lot more vitamin K than what they get through breast milk.
they're not getting vitamin K initially from colostrum either.
Right.
So, it's mostly your honey fix, your antibodies, your essentials, and vitamin K being a fat-soluble milk vitamin is not one of those.
Yep.
So, yeah, that's the gist for the vitamin K. Again, there's a couple other things people are concerned about. So obviously you want to talk to your healthcare providers, your pediatrician, your obstetricians, chat with them. There are some reasons that people don't want to give it. They not necessarily for pain stimulation to the infant, but people are concerned about what it actually is in the vaccine. So they're concerned about the preservatives. Yes. One of those we were looking up was benzoyl alcohol. That is one of the preservatives, I guess, used to help prevent the vaccine from deteriorating. However, our hospital also does offer, and many hospitals do, so check with your providers. Our hospitals offer a preservative-free option for vitamin K. So if that's something that you're interested in doing, if you want the vitamin K, you don't want the preservatives and the extras in there, we have that option as well. So
some of the other additives, the main thing you're going to see is actually the vitamin K, which is a name that I have a hard time pronouncing.
phytothiazidone,
something like that. And then the other things in it, the propylene glycol and phenol are just the stabilizers that kind of help hold it all together. And make it safe for actual ingestion or injection.
It is a fat soluble vitamin. So it's sometimes with the fat soluble ones, we kind of have to make them thin enough to be able to permeate the the cells and the muscle tissues. So otherwise we're just injecting a big fat glob of fat into your baby. That's going to hurt even worse. So, but yes, we have the preservative free option if you're worried about those. We got the stabilizers in it. I think there's some dextrose in it as well. The carbohydrates kind of help stabilize it. And another concern Delana and I were talking about is what's called the black box warning.
If you just Google
vitamin K,
that's what's going to come up. And that's because it's not only given to newborns for this particular reason, but it's also given to adults who are
on blood thinners. Yeah. So when a lot of medications and prescriptions come with what's called the black box warning. That's like the high alerts. This has happened. Here's what you need to be aware of. And so the black box warning for vitamin K is that it can cause like severe reaction, anaphylaxis, death, but that's more specifically to those folks that are on like the Coumadins and your blood thinners, things like that. And they say they're bleeding too much and they need something to counteract it. And this is given a different route than that. So, and that's why it comes up with that black box warning.
So actually, given to newborns, there have never been any documented cases of fatalities. As far as allergic reactions, there's only been one worldwide documented, and that was, I don't remember the year, but I think it was at least a couple of decades ago, and it was in the country of Turkey. And they're not even sure that the reaction that the baby was having was from the vitamin K.
Could have been something else too, but
and it was not fatal. It was totally treated and baby was fine.
So yes, this is one of those things. Talk to your pediatrician, talk to your healthcare provider. Is the juice worth the squeeze? Are your benefits greater than your risk? Or, are you worried about the pain and the ingredients and less worried about baby spontaneously having a brain bleed afterward? Think about those things. Yes. So, any more on that one?
I think that's everything I have on vitamin
Good deal.
K.
Okay. So, the next thing we're going to talk about is RhoGAM. Also called like Rofalac. There's several different brand names of it, I guess, but RhoGAM is your basis of it. And again, let me specify, I am not one of those people that says, take your vaccines. I'm not a super advocate of vaccines. I'll just say that. I don't necessarily think they're all important immediately. But it has been brought to my attention that several people think that RhoGAM is a vaccine. While it may act like a vaccine, and it may be given like one, it's technically not. Vaccines actually stimulate your body to produce antibodies in a like immunocompromised situation. So the RhoGAM vaccine injection is more of a blood type. It is a blood product and it is made from human antibodies. So it's technically called an immunoglobulin. And that comes from, like, we don't even get it from a pharmacy. When we have to give it, we get it from a blood bank. They still have to type and cross it as if it is a blood transfusion. It is
taken from the plasma.
It is taken from the plasma. They use these antibodies. So let's back up. What is RhoGAM? RhoGAM is a injection that is given at least twice for usually negative Rh negative mothers. Okay. So the Rh negative mothers, what ends up happening when they are pregnant, you have your Rh negative mama, and it's usually given at least between like 26, 28 weeks of pregnancy. It's the first one. And so while your baby, we don't know specifically the blood type, and you may not be able to tell that until later on. If you have an Rh positive blood type fetus, that mama's antibodies will start seeing that fetus as a threat. For whatever reason or another, I'm not a scientist. I don't know the science of it. But for whatever reason or another, and it may not necessarily affect your firstborn. Sometimes a Rh negative mother can give birth to a perfectly healthy firstborn Rh positive baby. But what happens is if those fetal Rh positive fetal cells start entering that mother's bloodstream, then it's going to trigger the O negative or Rh negative mother's blood cells to start producing an antibody around them, and they'll collect this antibody. And so if you have another infant with a positive antibody that's Rh positive, that mother's cells will say, no, I don't know what you're doing here. Let's get you out of here. And it can start attacking the fetus, the fetal cells. When that happens, the fetal cells will break down. They're being attacked. They're no longer big, fat, healthy, juicy cells. They turn into this little nothing, just like a little nothing. And the baby's body needs to process it. However, if they're still in utero, may not be processing it very well. It's going to cause a buildup. It's going to cause a buildup of fluid around baby's heart, baby's brain, baby's lungs, that if it's born with those things and it's unable to pass, there's also detrimental side effects. One of these being hemolytic disease of the newborn, also called HDN or HDFN. You may see that, and that's hemolytic disease of the fetus or newborn. So that is why it's given. It basically tells the mom's body to don't recognize this as as a enemy. We're not trying to attack it. So it prevents the mother's blood cell sensitization. So it is a blood product for that reason, because it has to come from other blood products. So that is the basic gist of that. Now, if you're thinking, okay, well, dad's Rh negative and mom's Rh negative, there shouldn't be a problem. Okay, if that's the risk you're willing to take, sure. But remember, people's genetics and blood types, they may have recessive positive genes on those. Right. So you may still get a positive baby for one weird way or another, just depending on the genetics. So again, be cognizant of those types of things. But it's not, I just want to put it out there, it's not a vaccine. It does not contain vaccine stabilizing agents. It comes from a blood bank. It is a blood product and technically called an immunoglobulin.
Yes. And when you do get the RhoGAM, it's not like a permanent fix. So you need to keep getting it. Even if you're in your third, fourth pregnancy and you say, oh, I've got it, before with another pregnancy, it's not permanent. So you need to get it every time between 26 and 28 weeks. If you happen to miss that one, then at least get it after delivery if we know that the baby is Rh positive. And that's something we test all babies when they're born. If mom is Rh negative or even O positive, then we always test the cord blood to see what the baby's blood type is.
To see what that incompatibility may be also. So we have had moms who got their RhoGAM in their 26 weeks, 28 weeks. They have a negative baby and they're like, oh, I don't really want that. I'm like, okay, sure. That's fine. I guess, no need right now, but, may need it in the future.
Well, and that's the thing. There's so many people, even if you say, I'm never having another baby.
Or the ones that get tubals.
How many times do unplanned pregnancies happen?
Oh, gosh, yes.
Or vasectomies that don't take.
Or especially when your OBs tell you that breastfeeding is a good birth control.
Yes. Or you're perimenopausal, so you don't think it can happen.
Things happen.
That's a big risk to take. But again, with people thinking that this is a vaccine, they worry about what's in there, and I do have the research on that one as well. I got this from the good people at evidencebasedbirth.com. So the primary active ingredient is going to be the anti-D immunoglobulin, which is what we're giving it to you for, derived from donor plasma. There's a little bit of salt and water in the injection and something called polysorbate 80. That's an emulsifier which holds the vaccine ingredients all together to stabilize
It
them.
holds the antibodies. Yeah.
And it is such a minimal amount for it to ever be anything that you'd have to worry about being a danger. I read that you'd have to give like 2,000 vials to reach that level. So,
and again, this is one of those things, if you're not into vaccines, that's fine. We're giving it to you, but honestly, it's not intended to hurt you or your baby. It's intended to help prevent any major issues that may happen for either this child or subsequent children thereon. So, and like I said, it doesn't necessarily always affect the first baby, but for some reason, if, like I said, O negative mother has, or Rh negative mother has Rh positive baby, it'll start recognizes those cells as an alien and it'll start attacking. So in the midst of looking up whatever's in RhoGAM, maybe also in your research, look up hemolytic disease of the newborn and hydrops fetalis. So,
yes.
and we'll talk about those in a second.
And I know that thimerosal is something a lot of people worry about.
Yeah.
There's no thimerosal or
thimerosal
other
in it.
preservatives in this vaccine. Or not a vaccine. Good
I know,
Lord.
we call it a vaccine. I know, that's what happens. That's why it's precipitated like that. 'Cause,
Yes.
yeah, it's easier said because it's given like a vaccine. It is.
Yes. If you see a needle,
Yes,
people are
vaccine.
commonly thinking vaccine, but it is not.
Also, if you're getting it after delivery, sometimes you can give it through the IV.
Yes.
Yes.
Always.
I like to do that because I feel bad.
Yes. Yeah. And so if you know that you need it, and you have your IV, that might be a good incentive to want to keep it just a little longer until you can get that injection out of the way.
There are some doctors that don't like to do that where we work, but I mean, for the most part, you can give it through the IV after delivery. Perfect.
And that's so nice because I remember 20 years ago, that wasn't even an option.
Nope.
When I started hearing about it being able to be given through the IV, I was like,
yes, I know. And I'll tell moms that. They're like, oh, I'll keep it. I remember that shot hurt. And I'm like, I believe you. Let's go ahead and do that. But yes, vaccines you don't give through the IV. I'll just say that.
Exactly. Okay, so ABO incompatibility occurs in approximately 15 to 20% of all pregnancies. I just thought that was an interesting statistic.
It's wild.
Let's see. And then, well, that doesn't even really have anything to do with RhoGAM, but ABO incompatibility oftentimes will also prevent as jaundice in the newborn,
Yes.
which we've talked about in previous podcasts.
Equivocally, hemolytic disease of the newborn. You know, if your baby's having these issues breaking down, it comes from the word hemolysis, which is the breakdown of the red blood cells. And those are passed through the liver, which again will precipitate sometimes some intense jaundice.
And so there can be cases of what we call a silent maternal fetal hemorrhage. So your blood cells are passed back and forth through the placenta sometimes, and that's how so many moms will get sensitized with the blood, and then they start fighting.
Yes. So one of our coworkers, actually, day shift, she had a sibling. So before this was, I think this was invented in like late 1960s. Anyway, so she's older, and one of her siblings actually died because the mom's, when she had her, the RhoGAM didn't exist, and so her sibling died at an infancy because of this.
Wow.
So she was Rh negative, got sensitized, and the mom's body basically attacked the newborn, the fetus. So it's wild, but yeah, so hemolytic disease of the newborn, not necessarily fatal immediately, but with a buildup, it can be. And so that can happen in utero and immediately after delivery.
Yep. Sometimes blood transfusions are required.
Mm-hmm.
Phototherapy, as we've talked
Yes.
about. Some babies even have such a rough time that they have to put on a ventilator.
Yes. And here's one too. This is devastating. If you're in the mood to really learn about what this can do and the effects of it, look up hydrops fatalis. The pictures alone are heartbreaking. And this is a direct result from the lack of RhoGAM. And it is a rare condition which too much fluid can build up in the baby's brain, lungs, organ, and it's severe swelling that presses on all their vital organs, presses on their brainstem, prevents them from being able to breathe, and it can cause death before birth or shortly after birth. So, thank God, I have not ever seen a baby with this, but like just from research and looking at it alone, like breaks my heart that a simple vaccine, immunoglobulin, a simple shot could prevent this detrimental effect in a newborn. Like, you just think of that poor baby, come out, can't breathe, doesn't know what's happening, is in pain, fluid buildup. It's so sad.
It is.
So while we talk about RhoGAM and we say RhoGAM vaccine, it's technically not. It's just an easier to say than
we understand
yes,
if you say that.
We understand if you say that because we obviously say it too. But RhoGAM immunoglobulin. So just to specify, not a vaccine, an immunoglobulin blood product. All right. Well,
you would get the RhoGAM. Okay, so you get it at 26 to 28 weeks, but you would also get it anytime during your pregnancy. Like, say you were in a car crash.
Yeah. Okay.
Or you fell and hit your belly. Or
ectopics.
Yes,
ectopic pregnancies.
So,
Tubules. Like, even if there's not necessarily a fetus, like you still want to get it just because again, we're protecting the following baby. So
yes. So, okay. I think
all right,
that
guys.
covers that.
Yeah. Well, thanks for listening. I know that was kind of a bouncy, all over the place episode. We bunny trailed today, but
it's what we do best.
I know, right?
We eventually get to the destination.
Yes, we
do. We've arrived.
We've arrived. All right, guys. Have a good evening.
Good night. Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.